to today's session. So, in the previous session, already we have discussed the basic of the cardiovascular drugs, right? So, there we have seen basically the classification of cardiovascular drugs. We have discussed regarding the first two types, that includes the hematinics, and then the second type, what we call it as the cardiac glycosides. So in hematinics, we have seen iron, folic acid, and vitamin B12 basically, whereas in cardiac glycosides, we have seen few drugs which are generally considered to be the natural elements in the human being, but synthetically we can use the drug like digoxin as our cardiac glycosides, which generally improve the cardiac contractility, their rate and strength, right? So that's how the cardiac glycosides will be using to manage a failing heart, right? So the third classification was the anti-anginal drugs. So we are going to discuss about the anti-anginal drugs today in details. So this third type of cardiovascular drugs is very commonly used to manage the patient with cardiovascular disease. Now, the name itself is suggesting it is related to the cardiovascular system and disease management, right? Because it says anti-anginal. I hope you guys remember where we have studied regarding angina, right? We have seen a patient sometimes will complain about severe squeezing chest pain, which is known as angina. Now, this angina will be generally caused because of the myocardial infarction. So, it is nothing but an effect of myocardial infarction, or maybe we can say a effect of or a part of acute coronary syndrome, right? So this is basically occurring because of the lack of blood supply into the myocardium layer of the heart, where definitely as the oxygenation and nutrient supply is not adequate enough, blood circulation is decreased into the myocardium layer. That is the reason why a person will be complaining about this particular severe squeezing chest pain, which is known as angina. So this particular group of drug, that is anti-anginal, means it helps to reduce the pain or chest pain, or we can say angina. So let us study together now about the anti-anginal drugs. So definitely this particular drugs used in the disease condition and the management of angina pectoris. Already we have studied regarding the condition of angina pectoris. You can just follow the different discussion of videos where we have discussed details regarding acute coronary syndrome, coronary artery disease, and angina together. So this particular group of drug will be used to manage the angina pectoris. Now, this anti-anginal drug have its own classification. Basically, we are going to see 5 categories of drugs. There are 5 categories of drug what we generally will be using as anti-anginal to manage the angina pectoris or coronary artery disease related symptoms. Now, these 5 classes of anti-anginal drugs include the first, known as the nitrate, the second group of drug, which are known as calcium channel blockers, the third, known as beta adrenergic antagonists, the fourth, known as potassium channel opener, whereas the fifth, we will be studying about some miscellaneous drugs. I hope you are well aware now about these 5 classes of drug which considered to be as a classification of anti-anginal drug. Now these are nitrates, calcium channel blockers, beta adrenergic antagonists, potassium channel openers, and miscellaneous drugs. Now we are going to read a one by one classification further. So nitrates are considered to be potent vein and artery dilators. So I hope you remember that when we were discussing regarding the coronary artery disease, we have studied about the medication administration of nitrates. So what does this nitrates do? Why we administer the medications to the people who are suffering from angina pectoris or a coronary artery disease is because nitrates is affect the vein or the arteries. Basically, here we are going to see nitrate is considered to be potent vein and artery dilators, which causes blood to pull in the vein and arteries to open up. Thus, it will be reducing the amount of returning blood to the heart. We can say ultimately this nitrate will be affecting the blood vessels and it will be dilating those vessels, and it will be also reducing the preload of the heart. Thus, this nitrates drugs will be reducing the workload of the left ventricle, as well as it will be helps to lower the blood pressure. I hope you understand. As it is dilating the blood vessels, the diameter within the blood vessels is getting increased. That is the reason the blood pressure within the blood vessels is getting reduced. But whereas we are going to see this nitrate also will cause decreased amount of preload, that's how the left ventricular workload, or we can say the workload of the heart here, also will be getting decreased. So basically, whenever we are administering the drug nitrate, the goal of the therapy includes restoration of the balance between the oxygen supply and demand in the ischemic region of the myocardium. So already we have studied that angina pectoris will be occurring because of the lack of blood supply to the myocardium, right? So once there is lack of blood supply, we already know that the cells of myocardium will more likely to go under necrosis. Now, because of that, generally the person will be complaining regarding the squeezing chest pain. Here what's happening, as we want to restore the blood flow or restore the oxygen supply to the tissues, that is the reason why we are administering the nitrates here. Once we are able to administer the nitrates, it's helping to dilate the blood vessels. It helps to circulate the blood more prominently within the coronary arteries, whereas it also reducing the cardiac workload. That's how it is maintaining adequate oxygen supply and demand by the myocardial cell even after gone for the ischemic state. So now we are going to learn the types of nitrates which are generally will be used clinically to manage the condition of angina pectoris or coronary artery disease related symptom. So basically, the nitrates will be classified under two categories. The first one is known as the short-acting nitrates. The second category is known as the long-acting nitrates. So the short-acting nitrates, the example of it is nitroglycerin, whereas the long-acting nitrate, the example of the long-acting nitrate includes isosorbide mononitrate. I hope you are clear about the short-acting and about the long-acting nitrates. Now we are going to learn here about the exact mechanism of action, how this nitrate is gonna affect the blood vessels and the cardiovascular system within the body. So already we have discussed about this. The first one, remember, this particular group of drug of nitrates will be reducing the preload. I hope when you have discussed or when we have discussed regarding the factors or factors related to the cardiac blood flow or cardiac activity, we have read about preload and afterload. So preload, I'm just giving you a brief, is if you name it or if you explain it in a simple term, it does mean that preload means how much blood is coming back from the body towards the arteries, right? So now here, as we have learned two type of nitrates, here we are going to learn about the mechanism of action of this particular drug of nitrate. So as we have mentioned earlier that this will be basically or primarily reducing the preload. So when we have discussed regarding the myocardial infarction or the normal functioning or functional mechanism of the heart, we have already studied about the preload. Now here I'm just giving you the brief in a simple term. If you want to say what is preload, it does mean the amount of blood which is returning back to the atrium of the heart through the vena cavas, right? Or through the veins, right? So this amount of blood which is returning to the atrium will be reduced by the usage of nitrates, right? That is how this nitrates will be reducing the workload of the heart, which definitely reducing the oxygen demand even where the ischemic zone has been formed. That's how it is maintaining balanced state of oxygen supply and demand. In the next part of mechanism of action of nitrates, we're going to see this will help to redistributing the coronary flow. So as in angina, we know that coronary arterial blood flow will be some or the other way getting interrupted. But this particular drug of nitrates, what it will be doing, it will be dilating the blood vessels. Now the zone where the ischemia has been already occurred, there we are going to see the dilation of the arteries will be more, so that the blood circulation or the blood flow to the ischemic zone will be more than adequate. That is the reason this particular nitrates will be increasing the blood flow to the ischemic zone and reducing the severity of the symptoms of angina, which is associated with the ischemic myocardial cells. So I hope now you are well known about how the nitrate drugs used in case of angina pectoris. And I also believe that whenever you are reading about the drugs, the easiest way to remember the drugs how it is affecting is to correlate with the disease condition. So I guess if you remember about the nitrates, you will remember the mechanism of action in a simple term, because what it does, it redistribute the blood flow to the myocardium. So definitely, even if you forgot about the drug, you will be able to write that where in case of angina pectoris we are going to use the drug of nitrates, right? That is how you are going to correlate with the drug, their activity or the mechanism of action, as well as the disease condition, and you will be more able to remember about the drug and its effect and in the treatment of a particular disease condition in case of medical, surgical, nursing. So we are going to see the drugs here. The mechanism of action is very important. So we have already learned about the nitrates, right? Now we are going to learn about the indications of this nitrates. So I hope you guys easily can understand now what can be the indications to administer this particular group of drug. So definitely the first indication will be angina pectoris, where a person is complaining about severe chest pain, squeezing chest pain, they will be provided with nitrates. The second one being acute coronary syndrome. So once a client was diagnosed with the coronary syndrome, definitely nitrate administration helps primarily to manage the client with the ischemia. So basically what it will be doing in initial phase, nitrate will be preventing ischemic zone formation in the myocardium. The third indication being myocardial infarction. So I hope you understand, even when the person has developed myocardial infarction, then also if you are administering the nitrates to the patient, definitely it will be redistributing the coronary circulation or coronary flow, through which we can actually prevent the progression of ischemic zone formation. The fourth indication includes the left ventricular failure or congestive heart failure. So, as we know, the left ventricular failure will definitely cause interrupted blood circulation. So, here we generally need to reduce the workload of the heart primarily. That is the reason nitrates here plays a very important role to reduce the ventricular workload, or we can say the heart workload will be reduced here. Cyanide poisoning is also an indication where we are going to use the nitrate as to treat the cyanide poisoning. I hope now you are completely understood the concept how the nitrate is going to reduce the preload and redistributing the coronary flow, and how or what are the indications where we are going to supplement or administer this particular drug. Now we are going to see about the contraindication. Contraindication does mean what are the conditions where we should not use or we should not administer this particular nitrates group of drugs to the client. This includes the constrictive pericarditis, where we are going to see there will be constrictive pericarditis formation. We are not supposed to administer this particular group of drug. Mitral stenosis and inferior myocardial infarction also two contraindication where we are not supposed to administer the nitrates. So I hope you remember the indications and contraindications. Now we are going to learn about the adverse effect or the side effects of this particular drug of nitrate. The side effects being which is associated with central nervous system includes a severe headache and restlessness. Whereas the side effects related to cardiovascular system includes the tachycardia, palpitation, hypotension, even there can be cardiac collapse. So basically, once a person is administered with the nitrates, definitely we should keep the patient on continuous monitoring. And if any early sign and symptoms is present, which is indicating which is present like palpitation, hypotension, we should definitely supplement with essential treatment and therapies to manage the client and to prevent the complication development. The side effects of this drug associated with gastrointestinal tract include nausea, vomiting, and abdominal pain. Whereas in case of dermatological side effects includes the rashes and exfoliative dermatitis. Now it is very rarely seen that the person are developing some very severe side effects associated with nitrates until and unless they are having a allergy or hypersensitivity towards the nitrates. That is the reason this is considered to be a drug which is safe to administer in emergency situation to manage the condition like myocardial infarction as well as angina pectoris. Now the local side effects can be a burning sensation, and basically this burning sensation will be occurring at the point of dissolution of the drug. So that is how generally the nitrates will be acting. Now we're going to see often the nitrates will be used or administered into the sublingual route. So sublingual route makes sure very early absorption of this particular types of drug into the blood circulation, which will be considered to be have a short acting activity. So that's how in an emergent situation nitroglycerin can manage the ischemia formation or can prevent the progression of ischemia. So I hope we have discussed now about the first category of anti-anginal drug, which is nitrates. Now the next group or the next category of anti-anginal drug is being calcium channel blocker. So here now we are going to learn about the calcium channel blocker. So calcium, as we know, plays a central role in the electrical stimulation. So when we have discussed about the action potential development and the conduction system of the heart, I hope we have discussed about the electrolytes activity over there, and we have seen how the calcium is basically maintaining the activity of the muscle cells. So calcium is considered to have a central role in the electrical stimulation formation, right? And calcium channel blocker, at the name itself is suggesting that is reducing the activity of the calcium. Now it is generally a synthetic group of drugs which is newly found that work by blocking the passage of calcium into the muscle cells. That's how, first of all, it will be reducing the cardiac muscle contractility, and also it will be controlling the sizes of the blood vessels. So I'll repeat once again here that basically all the muscle cells will be containing with calcium channels where the calcium inflow will continuously occur, and because of that the action potential will form and it will be maintaining the contractility of the muscle cells, as well as it will be helps to maintain the size of the blood vessels. But here we're going to see the calcium channel blocker. At the name itself is suggesting this particular group of drug, what they will be doing, they will be blocking the calcium channel which is present in the blood vessels as well as to the muscular layer of the blood vessels and heart. That's how it will be blocking the calcium inflow, and it will be alternating the contractility of the heart muscle layer, as well as it will be alternating the size of the blood vessels. So as I have mentioned, all muscle cell needs calcium in order to constrict. So what happens here, as the arteries here also are not getting adequate amount of calcium, it will go for a dilation. So the calcium channel blocker is dilating the area of the blood vessel. That is how it is reducing the blood pressure within the blood vessel. So calcium channel blocker is considered to be very effective in initial treatment of high blood pressure. About 30 to 40% of people with severe hypertension also consume this particular calcium channel blocker, which is considered to be very effective in managing the hypertension. So the calcium channel blocker further can be divided into two different classifications. The first classification is known as dihydropyridines. So the example of dihydropyridines includes the nifedipine and amlodipine. Whereas the second classification is known as non-dihydropyridines, which is known as the verapamil diltiazem. So these are the two drugs which are considered to be under the classification of non-dihydropyridines. So now we are going to learn about the mechanism of action of calcium channel blocker. We are going to learn here how it is affecting or how it is managing some disease condition which is affecting the cardiovascular system. So calcium channel blocker have a negative inotropic effect over the myocardium layer. Now in the last session already we have discussed that the cardiac glycosides have the positive inotropic effect, where the muscle cells will be increasing the rate and strength of their contraction. Whereas we are going to see this particular calcium channel blocker is having negative inotropic effect. So what happens basically here is this particular calcium channel blocker, inhibit the entry of calcium into the cardiac and smooth muscles. Generally, it blocks the L-type calcium 21 channel, which is a main port from where the calcium ion comes inside the muscle cells like cardiac muscles and smooth muscles. So as this particular drug is reducing the calcium inflow, we're going to see, first of all, it will be dilating the smooth muscles that is associated with the arteries or artery wall. That is the reason why it is lowering the blood pressure, as it is reducing the peripheral resistance. In the other hand, it will also reducing the rate and strength of the contraction of the cardiac muscle. That's how it is lowering the blood pressure and also lowering the cardiac workload. I hope you get the idea how the calcium channel blocker is using or is affecting the blood vessels and the cardiac system. Now, as it have a negative inotropic effect, definitely these drugs will be used in certain disease where we need to maintain or decrease the cardiac workload, as well as we need to decrease the blood pressure by reducing the peripheral resistance. So now we are going to learn about the indications of calcium channel block. So the indications being hypertension, ischemic heart disease, chronic pulmonary disease, diabetes mellitus, as well as angina and peripheral vascular disease. So these are the indication or these are the disease condition where we are going to use this particular drugs so often. Basically, you need to understand the calcium channel blocker will be helps to reduce the workload of the heart. That is the reason why in case of ischemic heart disease and chronic pulmonary disease, we are going to administer this particular drug. Whereas in case of diabetes mellitus, angina and peripheral vascular disease, we are generally going to reduce the blood pressure which is affecting the blood flow or the circulation. That is how this particular drugs is going to used. Now, next we are going to learn about the contraindication. What are the disease condition where we should not use this particular drug? The first being the congestive heart failure, whereas the second being is hypotension. So as we have known that the calcium channel blocker will be further reducing the blood vessels or peripheral vascular resistance. That is the reason in case of hypotension, we are not going to administer calcium channel blocker. Whereas in congestive heart failure, already the heart will be in a failing state where if we are providing the negative inotropic agent, it will be furthermore decreasing the contractility of the heart. So definitely the circulation of the blood will be completely interrupted. That is the reason in this two condition, we are not supposed to administer the medication of calcium channel blocker. The third being the hepatic injury and renal disease. These are the two acute contraindication where we are not supposed to administer the drug of calcium channel blocker. Pregnancy and lactation is also considered to be contraindication for the administration of calcium channel blocker. If a client is having gastroesophageal reflux diseases, we are not supposed to administer this particular group of drug. Now, we are going to discuss here about the side effects of calcium channel blocker. So, the side effects associated with central nervous system includes dizziness, lightheadedness, and fatigue. Whereas the second adverse effect or side effects, which is almost always associated with cardiovascular disease and most commonly found associated with administration of calcium channel blocker, include the peripheral edema and tachycardia. The next side effect, which is related to the dermatological effect, is the flushing and rashes development, which is very commonly found among the individual. Whereas the gastrointestinal system will show the symptoms like abdominal discomfort and nausea and vomiting. Even anorexia will be complained by the patient. Now you need to remember these are the side effects which not very commonly seen or not very severely affects the person or the individual person. That's the reason these are considered to be very first line choice of treatment in case of angina or in case of hypertension or any other cardiovascular disease where there is need of the maintenance or reduction of the blood pressure, as well as where there is a need to reduce the cardiac workload. So I hope till here you have learnt about the two basic classification of anti-anginal drug that includes the nitrates and calcium channel blocker. So furthermore, we are going to consider, or we are going to discuss regarding other three group of drugs. Among them, the beta adrenergic antagonist and the potassium channel opener. We are going to discuss in details, and we are also going to learn about the very basic miscellaneous drugs which are generally will be used in case of angina or acute or coronary artery disease related symptoms. I hope you understood the concept of nitrates as well as the calcium channel blocker. Thank you so much for attending the session. Stay tuned for the discussion of the anti-anginal drug further.